Dr. Parin, good evening. You are on mute. Please unmute yourself.
Yeah, sorry. Good evening, Neeraj sir. Good evening, Dr. Ellen.
Thank you very much for accepting our invite.
Thank you for inviting.
So this is a different type of a topic, and only few people can speak on this. So thank you very much.
Thank you so much.
And thank you, Dr. Ellen, for agreeing to be the moderator for the first session of the series.
Thanks a lot, sir, for inviting me for the same, sir. It is great.
Good evening, Neeraj sir. Good evening, Dr. Ellen.
Thank you very much for accepting our invite.
Thank you for inviting.
So this is a different type of a topic, and so this is there is an echo which is going on from YouTube. Is it correct? Thank you very much.
Yes, sir.
Thank you so much.
So how should I go about that? Means like, should I switch it off? How should I do that? Moderator for the first session of the
So maybe you can put that volume 0. You can put that volume off.
Inviting you for the same, sir.
Okay. So am I audible to you now?
Yes, sir. There's no echo and you're audible, right?
Yes, but now there is no echo. So I have muted that YouTube one. Do you have any idea, Dr. Allen, that means like if the questions which will be there in the chat box of YouTube, so how they will be, you can say like coming to us. Any idea about that?
No, sir. Maybe I will have to open the YouTube
Can
channel
you do
at the
that for
side.
us? Can you do that for us that you simultaneously open the YouTube on some other device with yourself? And then you please see the questions there because the questions will be typed there. Meanwhile, I will also try that if I can get the questions from there and then type here, but I don't know how to do it. And please mute, please keep that muted, otherwise the sound will cross.
I'm clicking on the YouTube channel, but it is not. It is showing me a subscribe page. It is not showing me today's lecture page.
No. If you just go to the link which we have just shared, so it should come.
Yes, sir. I'm getting the Pediatric Allergy Association of India. I'm getting the subscribe page. I'm not. Let me click on the live. Let me see. Okay, yeah. Now it's.
Is it getting, because from my side it is showing that the content of this meeting is sending on the YouTube.
Now I can see it. Yes.
Yeah, so I think it will be better that if you keep it open, but keep it muted so that you can see the questions.
Again, can everyone see the questions? Because it is telling me sign in to chat, so I'm not sure if I'll be able to see the questions.
No, in the chat box only, where it is showing.
Yes,
so
yeah, just telling me to sign in to chat, but I haven't signed in. But let me see if I can see the questions which do come in.
Let me type something and see that whether it is coming or not. Let me type something. So chat. Okay. I have just written what is allergy.
Yes, I've got it. Yes, so it seems to be fine.
Yes, so I think then you should be able to see the questions, whatsoever questions are asked.
Yes, that should be fine.
Dr. Pankaj sir, good evening. Pankaj sir, good evening.
Good evening, Neeraj bhai.
Good evening, Reddy sir.
How are you? कैसे?
I am good sir. I am good sir. आप कैसे हैं?
सब अच्छे अच्छे. कैसा है गर्मी कैसा है दिल्ली में?
चल रहा है सर, बढ़ गया है सर. 36, 37 हो गया है, बढ़ेगा. Pankaj sir, good evening.
Good evening to all. I'm Dr. Pankaj Verma. I'm the General Secretary of DPS.
Sir, good evening sir. Sir, good evening.
Good evening. Good evening.
Thank you for joining sir. Thank you.
Yeah. Thank you.
Pankaj sir, good evening. Thank you for joining sir. Sir, you are muted.
Good evening, sir. How are you, sir?
I am good sir. Thank you sir. Thank you for the joining and thank you for the opportunity sir. So we will be starting in another minute. It's 7:59. We will start it.
Okay. Good evening, President Saab.
Good evening, boss. Good evening. कैसे हैं आप?
बहुत बढ़िया, बहुत बढ़िया.
So nice to see you.
Good, good, good.
Good evening, friends. I am Dr. Neeraj Gupta, and I have the privilege of serving as the chair of IAP Allergy and Applied Immunology chapter. It gives me immense pleasure to welcome all of you to this important and timely interdisciplinary webinar on allergy, allergists, and mental health. This initiative stems from a growing realization that allergic disorders are not just physical ailments, they often come with a significant emotional and psychological burden for patients and families. At the same time, we must also acknowledge the mental health challenges faced by allergists and clinicians working in this demanding field. Today's session brings together esteemed experts from allergy, psychiatry, and psychology to help us understand and address this vital connection. From stress related worsening of allergies to burnout among physicians, this discussion aims to promote holistic care where mental and physical well being go hand in hand. I am truly excited about the conversations we are about to have, and I thank each of you to joining us in this meaningful journey. Here, on behalf of IAP Allergy and Applied Immunology chapter team, I would like to thank Delhi Psychiatry Society for accepting our invite and joining hands for this unique initiative. I would like to invite Dr. Pankaj Kumar, President of Delhi Secretary Society, for his views about the session. Dr. Pankaj sir, please.
Thank you, Dr. Neeraj Gupta and IAP for giving this opportunity to me and the DPS Delhi Secretary Society to have collaboration with you for this important topic. Good evening, everyone. Welcome to today's webinar. We are here to explore the fascinating intersection between allergy, allergist, and mental health, an area that's gaining more attention with each passing year. Have you ever wondered how something as physical as an allergy could affect something as intangible as our thoughts, emotions, and mental well being? Today, we are diving into this compelling mind body connection. In our clinics, we often treat allergic reactions symptoms separately, but if we are more connected than we think. This webinar brings together insights and immunology and psychiatry to explore this overlap. Many of us have sneezed out our way through spring or avoided certain foods like plague. But what we often don't realize is that chronic allergies can quietly weigh down our mental health. Today, let's uncover how and why. That's very vital and pertinent area to discover and focus on. With emerging research highlighting the psychosomatic impact of chronic illnesses, today's session focuses on a dynamic interplay between allergic conditions and mental health, offering new perspectives for both clinicians and researchers. Once again, I welcome you all in this important and clinically significant webinar. Wish you all the best. Thank you. Over to Dr. Neeraj Gupta, over to you.
Thank you, Dr. Pankaj sir. We have now got Dr. Alan Pereira. He is a senior pediatrician and allergist at Children's Hospital, Mumbai, and he has kindly accepted to moderate the session. Thank you, Dr. Alan, for moderating today's session. Hand over to you. Let's begin.
Thank you, sir, for having me. I welcome you all to this novel and very interesting chapter which we are going to focus on today. So far, whenever we talk about allergies, when we talk to a patient, when we are talking to a child, we always stress on what we can see. We ask the patient, how is your cough? How is your cold? How is your asthma? Today, topics bring up highlight what is unseen and what we usually forget to ask about. Something that we rarely think about, something that we seldom ask the patient, how are you feeling apart from your illness? How is like we do not take the time to look beyond the cough, beyond the cold, beyond the eczema. So when we look at a child, when we talk about the mental health of a child, or when we talk about the mental health of a person, rarely we ask them, what would you like others to know about you? What would you like others to know about your mental health today in relation to your illness or to your allergy? Quite often patients think that, okay, the basic bare necessity of what I would like others to have is to understand my condition today, or my food exemptions today, or my choices today are not something which I have done out of my own choice, but something which is beyond my health. It is something which I have to do, not something which I want to do. So not dealing any further, I now invite Dr. Parin Parmar, who's a pediatric allergist and an integrative medicine consultant practicing out of Rajkot, to look at unraveling the biophysiological interactions where we look at allergy and mental health. Over to you, sir.
Thank you, Dr. Alan. Thank you, Dr. Neeraj Gupta and Delhi Secretary Society for organizing this beautiful event, and especially Dr. Neeraj Gupta for inviting me for this topic. I would like to share my screen here, my slide here. I hope it is visible.
Yes, sir, it is visible.
Yeah. So let us discuss the biopsychosocial interactions that underlie behind allergy and psychiatry or psychology or stress. Okay. So before I come to the main topic, I just want to discuss some fundamentals of allergy. Like allergy is a disorder of immune system, and it is characterized by an abnormal immunological clinical reaction to a harmless substance, which is known as allergen. So it can present in many systems, like it can present with allergic rhinitis, asthma, GI allergies, allergic conjunctivitis, urticaria, angioedema, or eczema. So it can present in different systems, but the underlying abnormality involves the immune system. An immune system, we know that it's a deeper system in the body and it is a complex system in the body. So when we say that it is allergy is usually towards harmless substances, they can be house dust mites, they can be mold, they can be pet, they can be some foods. And when an antigen interacts with T cells and antigen presenting cells, ultimately there is production of IgE antibodies, and ultimately they sit on the mast cells, and upon further exposure to the allergen, there is degranulation of mast cells, which leads to the allergic reaction. So basically, when we talk about allergy, then we say that it is the Th2 mediated response that dominates in the immune system rather than Th1 mediated response, which is seen in non-allergic patients more often. So the cytokines involved in Th2 response are interleukin 4, 5, and 13, while those in Th1 are other cytokines. So let me briefly introduce stress as well. So if I talk about definition, it is a systemic response to any real or perceived threat that enhances psychological and physiological activity to cope with the stressor. So this is one of the recent definitions. So basically it is the systemic response of our body. Okay, stress is not something outside, but stress is a response from our body to some stressor. We can say eustress and de-stress. For example, if there is some motivation, then it is a eustress, which is beneficial one. But when the stress becomes excessive, it becomes de-stress. And when we are talking about disease or pathologies, we are more focusing on de-stress. It can be again acute or chronic stress. For example, if there is some natural disaster, then it is acute stress. And in modern life, in day-to-day life, we all experience chronic stress in the form of social demands or emotional disturbances or demands of the job or financial stress or so many types of stress. So they are either acute stress or chronic stress. Again, when we are talking about psychosomatic disorders or especially role of stress in development of chronic disorders, then we are more focused on chronic stress. And least talked about stress is again oxidative stress, but we'll talk about it later. And WHO has mentioned that stress is the epidemic of 21st century. That is very interesting, and that's what we see actually in our daily lives. So let us see how allergy is related to stress. So for example, if we talk about allergic rhinitis, then the children or adults with allergic rhinitis can be stressed because of so many concerns, because they can be concerned with the symptoms and symptoms which lead to isolation, frustration, or helplessness, because most of the medicines which are used in treatment of allergy are usually about symptom treatment, or at the most they can control inflammation. But the allergic disorder tends to recur upon discontinuation of many of the medications. That's why allergic symptoms are unpredictable and they are discomfortable as well. So it leads to poor quality of life. And allergic is a systemic inflammatory disorder. So chronic inflammation itself can lead to alteration in CNS neurotransmitters. And that includes histamine as well, because histamine, we know that is one of the common transmitter which is released upon mast cell degranulation, and histamine plays a significant role in CNS. There are all types of histamine receptors in the brain, central nervous system, which lead to so many alterations in the psychology and neurology. So the studies have shown that patients with allergic rhinitis, 65% of patients have stress, And nearly half of the patients have poor sleep quality. More than half of the patients have inadequate sleep if we define optimum duration by 7 hours. At least 1/4 of the allergic rhinitis patients have anxiety and depression, and 14% of allergic rhinitis patients have suicidal thoughts, and actually approximately 4% of the allergic rhinitis patients attempt suicide. So that is how allergic rhinitis affects stress levels of the patient. Similarly, another airway disease, allergic airway disease, which is asthma, then approximately half of the patients experience stress, 15 to 45% experience anxiety, and almost 18 to 48% experience depression. And overall, 28 to 80% of the asthmatic patients have other psychiatric disorders like panic or something else. And the studies have shown that when asthma is associated with any of the psychological morbidity, either anxiety or depression, it significantly reduces quality of life rather than having only asthma or rather than having only a psychological morbidity. So the quality life deteriorates drastically when there is an additional psychological comorbidity. Interestingly, when we talk about asthmatic children, all these anxiety, stress, and depression increase by 3 times as compared to general healthy children. So this is what studies have shown. Similarly, it's not about only patients. When children have asthma, then their caregivers have also so many stressors, like they have to care for the children, they have financial concerns, they experience the responsibility for the treatment, and the repeated visits interfere with their daily life. So there are so many reasons to be stressed for their caregivers, and studies have shown that as compared to general population, caregivers of asthmatic children experience 2 times stress, anxiety, and depression. This is a very interesting study about asthma and depression in children, and it was a longitudinal study conducted in 2013, and it has shown that when there is asthma plus depression in a child, then they are at significant risk for systematic inflammation. So asthma only or depression only, the systematic inflammation is less, but when they both are combined, then systematic inflammation is very high, and it's supposed to last longer. And also another factor is that when children with asthma have depression, they are less likely to seek treatment. They are also less likely to comply with the treatment, which leads to poor asthma control, which ultimately leads to a vicious cycle. And so ultimately asthma becomes more uncontrolled. And we do not know, but that whether it really leads to future cardiovascular or metabolic risk in children. But at least we know that if systematic pro-inflammatory state is there, then it may increase some metabolic or cardiovascular risk in future. So this was an interesting study as well. Talking about atopic dermatitis, then again, it is a very frustrating disorder for many of the children and adults, especially if it is moderate to severe in variety. And it leads to severe sleep disturbances, severe itching, chronic condition, doctor visits, systematic medications, long-term requirement of the treatment. And because of the skin involvement, sometimes children do not mix with their colleagues, friends, and leads to social isolation. They are also fatigued because of one is systematic inflammation, second is sometimes side effect of the medications, and overall it leads to poor quality of life. And systematic meta-analysis of 31 studies has shown that stress, anxiety, depression are increased significantly as compared to general population in patients with atopic dermatitis. Even suicidal ideation is also increased in a significant number in patients with atopic dermatitis, especially of severe variety. And it's as a clinician, it feels really bad when and worrisome when a patient with atopic dermatitis says directly that I feel that I may end my life because of this chronic condition. I'm so frustrated with this condition. So it really matters to handle those issues. And talking about urticaria, now, contrary to the common beliefs, 40 to 50% of chronic urticaria are idiopathic. So many times patients do not know the cause of their condition. And again, it is a condition associated with severe, chronic, or persistent or recurrent itching. And ultimately, it is associated with sleep disturbances, anxiety, and depression. Almost half of the patients have these issues, and over 1/3 of the patients have depression issues. Talking about food allergy, again, children with food allergy have half of the children have anxiety issues, 1/3 of them have panic issues, and overall 2/3 of the children with food allergy experience some of the psychological disorders. And likelihood of psychological morbidity increases when there is more than one reaction per year. So that is what the studies have shown. Now, so it is clear that allergic disorders are chronic or recurrent disorders, and the patients with allergic disorders experience significant stress in their own lives, and they also are prone to other psychological conditions. Now, it is also important to know that stress itself contributes to allergy, and that creates the vicious cycle. Allergy leading to stress and stress leading to further allergy. So all these things came into light when the field of psychoneuroimmunology was developed, and now we know that there is a continuous crosstalk ongoing between central nervous system and immune system. So all our systems are not static, but they are dynamic, and they are always in communication with each other. So the central nervous system has neurotransmitters, neuropeptides, neurological growth factors, and hormones like adrenaline and cortisol, which help CNS to communicate with the immune system. On the other side, our immune system cells release cytokines, chemokines, interferons, and nitric oxide to give feedback or to communicate with the central nervous system. So there is ongoing communication between the two of the deepest systems in the body. So there are so many mechanisms actually how stress contribute to development of allergy and how it influences the immune system negatively. But this is the most popular or most researched pathway which shows how stress leads to development of allergy. So especially when there is chronic stress, it activates hypothalamus to secrete cortisol releasing hormone, CRH, and CRH makes anterior hypophysis lobe to release adrenocorticotropic hormone, which is ACTH, and ACTH ultimately leads increased secretion of corticosteroids and adrenaline and noradrenaline through adrenal cortex and adrenal medulla. And it is because of increased cortisol in the body which favors the secretion of pro-allergic cytokines like interleukin 4, 10, and 13. We have earlier seen that when our immune system develops allergy, it is towards Th2 type of immune response, and the cytokines are interleukin 4, 10, and 13. So it shifts the balance of immune system towards Th2 response rather than Th1 response. On the other hand, adrenaline and noradrenaline, they decrease interleukin 12, which is the cytokine of Th1 system. So there is ultimately the shift of balance towards Th2 type of immune response. One more mechanism is stress, either directly or through release of CRH, stimulates locus coeruleus to increase noradrenaline secretion, and ultimately it leads to activation of sympathetic nervous system, and it also reduces interleukin 12, which is the cytokine of Th1 system. So overall, chronic stress leads to switch or rather shift of balance towards Th2 mediated immune responses, which are basically allergic immune responses. But this is only one, and as I said, most popular or most research mechanisms. Now, there is continuous CNS immunity crosstalk, and it is complex. It is on multiple levels, and at times it is contradictory. So we have seen that there are so many chemicals which help the communication between the two systems. So one of them is substance P, and the receptor for substance P is neurokinin 1 receptor, which is there in bronchial vessels, bronchial smooth muscles, epithelial cells, submucosal glands, and immune cells. And substance P leads to neurogenic inflammation, so especially in the airways. So this is another mechanism how stress leads to inflammation in airways. And substance P directly is a potent vasodilator, and it also directly stimulates mast cell degranulation, which is seen in allergic reactions. And again, one more thing, neuron growth factor, which is NGF, it has effects on central nervous system, it has effects on immune cells, also structural cells here like keratinocytes and epithelial cells, and it also increases eosinophil survival in the lungs. So chronic stress leading to increase in NGF leads to these changes in nervous system and the skin as well as airways of the body. And another growth factor is brain-derived neurotrophic factor, which leads to increased production of specific IgE, and also it reduces Th1 kind of cytokine profile. So again, it favors shift to Th2 type of immune response, which is the allergic immune response. Now, there is something more. It's not that a child is born or an adult is under some stress during life and then there is development of allergy. There are a lot of studies and now a lot of evidence favoring that actually allergies can start in fetus. So there is a lot of evidence of maternal stress, especially during pregnancy and during the perinatal period. And there are mechanisms known like maternal stress during pregnancy can lead to increased placental CRH, and which leads to increased secretion of cortisol in the fetus. And cortisol is an important hormone for development of different organs, especially in the fetus. And increased fetal cortisol leads to fetal stress response, like activation of HPA axis, catecholamine secretion, and neurotrophin secretions. And we, just like adults, cortisol leads to stimulation of Th2 mediated responses. So fetal cortisol leads to shift of development of immune system towards Th2 dominant response. So the fetus production starts for specific IgE or Ig antibodies in response to fetal stress. And this is one mechanism. The another mechanism is again, because of fetal stress response, there is increased reactive oxygen species in the fetus, which is an oxidative stress. And increased oxidative stress also leads to shift to Th2 dominant responses. And the third thing is fetal cortisol, when binds to glucocorticoid receptors in the fetus, it changes gene expression. So it cannot change genetic sequence, but it changes expression of genes, which favors development of Th2 dominant response in the fetal immune system. So by various mechanisms, maternal stress leads to development of allergy in immune system of the developing fetus. And several studies have shown that when maternal stress is high during pregnancy or is in immediate postnatal period, children are more likely to develop atopic dermatitis and asthma in later life. Now, because of time concern, I am mentioning other mechanisms as well, how stress affects allergy. So we have oxidative stress that we have partly discussed, and the stress has some direct effects on mast cells, which leads to increased mast cell degranulation. There are a few studies in humans, but more studies in animal models, which suggest that chronic stress can lead to disruption of intestinal barrier and increase intestinal permeability. Studies have shown that chronic stress that alters intestinal microbiota, especially decreased bifidobacterium and decreased lactobacilli, which has some role in development of allergy. And chronic stress can lead to intestinal inflammation. And stress affects cutaneous neuroendocrine system, which leads to increase itchy conditions like eczema and urticaria. And last but not the least, chronic stress has shown to alter DNA methylation of several genes, which leads to development of allergy-prone immune system. So that is how stress affects epigenetics. So again, stress cannot change the DNA sequence or genetic gene sequence in the chromosome, but it changes expression of several genes to produce allergic disorders. Now, so these are theories, but we also are interested in understanding the clinical relevance of these theories. So this is an interesting one. A recent systematic meta-analysis of 6 randomized controlled trials evaluating effects of behavioral therapies in atopic dermatitis. The behavioral therapies included cognitive behavioral therapy and habit reversal behavior therapy. And the meta-analysis shown that there is reduced severity of eczema and there is reduced severity of scratching. And but there was no effect on intensity of itching in this meta-analysis. So psychological interventions help patients with atopic dermatitis. Similarly, there was a systematic review of 15 randomized controlled trials involving asthmatic adults and 12 RCTs involving asthmatic children and adolescents. And the systematic review, the results shown that biofeedback as a form of psychological intervention, it showed to reduce controller medication use and increase PFR in the patients. Cognitive behavioral therapy showed to improve asthma quality of life. It also improved symptoms of obstruction in asthma, and it also improved symptoms of anxiety in asthmatic patients. And relaxation techniques, they showed to reduce rescue medication use and to improve self-efficacy of the adult patients. And in children, there were only 2 studies which showed that relaxation techniques in asthmatic children and adolescents showed to increase PFR. But 2 studies are really a small number. So, but overall, if we look at the picture, psychological interventions again helped both children and adults with asthma. Now, let me stress some interesting studies as well, how stress can influence treatment outcomes. Because usually as an allergist, usually we are more focused on treatment of the patient, which is in front of us actually, rather than going deep into the psychology of the patients. So a study in 2006 included 40 children with mild asthma, with allergy to house dust mite, and all were started sublingual immunotherapy 6 months back. And they were divided into stressed group using a validated tool. So they were divided into stress group and no stress group. And after 6 months, it was shown that the children who were in non-stress group, they had greater improvement in symptom score, PF, and serum eosinophil cationic protein. So even they were on the immunotherapy, the outcome was different in stressed children and the outcome was different in the non-stressed children. So it can affect the treatment. Similarly, this was another study which showed that short-term stress and long-term stress, when both were there, then it lead to 5.5 times decrease expression of genes encoding glucocorticoid receptors and 9.5 times reduced expression of genes encoding beta-2 adrenergic receptors in the asthmatic children. So ultimately, when an asthmatic children presents with bronchoconstriction, if the glucocorticoid receptors and beta-adrenergic receptors are less, then the poor response to treatment is likely. So they are more likely to be resistant to the standard treatments and ultimately leading to increased morbidity in the asthmatic children. And last but not the least, mental health is definitely an unmet need in allergy today. And this is a study from 2013 where 454 caretakers of children with food allergy were surveyed, and 70% of them reported that mental health support would be helpful, but only 23% of them received mental health support. So it is definitely an unmet need in allergy. And if I talk about my personal experience in allergy, then I definitely see so many children who start developing some allergic disorder within 6 months of some major stressor in their life. And usually the common stressors are like divorce or death of a family member or something like that. So that is what we see actually. And again, exam times are when the children present with exacerbation of their allergic disorders. So definitely, it is very important to look at the mental health aspect and do some psychological interventions. However, there are challenges in this area because there are so many psychological interventions like psychological or behavioral or relaxation techniques or meditation or mindfulness. So which psychological intervention? The number of study and evidence today is limited. We require more studies to exactly identify these interventions. And there are some interventions with multiple mechanisms like yoga and acupuncture. So they have stress reducing effect, but they have other physiological effects as well. So we don't know how, to what extent the stress contributes to these techniques or interventions. What is the correct dose or duration of these psychological interventions? And ultimately, to what extent we can expect the efficacy of these interventions. And as I mentioned, there is small number of studies or the studies which are really small in size, and we have limited resources at times, financial or in terms of human resources to holistic manage a child with or adult with allergy. And there are social factors. For example, if we say that stress is contributing to the allergic disorder of your child, then sometimes parents do not accept it. So that is also what we actually see in clinical practice. So these are challenges, but there is definitely an evidence and theories that support that stress plays a huge role in development of allergic disorders. These are all the references which were used in this talk. And the most important thing is to break the vicious cycle, because as we saw here, that stress leads to allergy, allergy leads to stress, and sometimes stress begins in maternal, in the mother itself during pregnancy. So we need to be aware of this, and we definitely should think of psychological intervention as a holistic treatment of all the allergic disorders. So thank you very much. I again thank the allergy immunology chapter of IAP for inviting me for this talk. Hope it was useful and informative. And I would like to end here with a quote from Hans Seile, who is an endocrinologist and who was known as father of stress research. He contributed to so much to the physiology of stress. And he said that it's not stress that kills us, it is our reaction to it. So thank you so much. And I am ending my presentation here. Over to Dr. Elan.
So, lot, sir, that was a very insightful talk. You try to bridge in the gap between the seen and the unseen, and what we are seeing physically, we should also start looking at towards the mental health of our children.
Thank you.
Now, when we look at mental health and we look at stress, we have to realize that an anxious or a stressed child is not always a child who's nervous or who's angry, but sometimes it can just be a quiet child or the so-called labeled difficult children who are difficult to control. Parents say, oh, my child is very difficult. These may actually just be a sign of the underlying stress that the child goes through. And overall, we also have to teach a child that it is, as Dr. Paran just said, it is not the stress or the which is important, but our reaction to it. And we have to choose how we react, and that is what will is the outcome of the day for us. So now over to Dr. Deepak Gupta, who's a consultant child and adolescent psychology at Sir Gangaram Hospital, New Delhi. He's going to talk about the stress management in children and more importantly, the stress management in their caregivers. Over to you, sir.
Yeah, good evening, everyone. First of all, thanks to the IAP Allergy chapter and Dr. Neeraj Gupta for inviting me. It's my pleasure, honor. And thanks to you, Dr. Perrin, who beautifully outlined. And the last thing which he said, that how stress leading to allergy and allergy leading to stress, somewhere we need to break that vicious cycle. So a lot of times we don't know whether it's allergy causing the stress or stress causing the allergy. And what is the source of all this coming from the maternal factors which may be contributing. So in this presentation, we'll try to highlight some of the important points. How can we manage the stress? And though he beautifully outlined the various mechanisms, and how the different aspects of biological mechanisms are there, which contributes and which leads to various, the stress and stress related issues. So what is stress? Everybody talks about what is stress. Stress, we know, is a physiological and psychological response to perceive threats or demands that disturbs an individual homeostasis. So the individual homeostasis is altered, that get disrupted, and it activates complex systems like what Dr. Parin was talking about, involving the central nervous system, autonomic nervous system, and hypothalamic pituitary adrenal axis. So all that, there's a biological mechanism behind it, and that's what gets activated. That's what stress comes to us. Now, we already, Dr. Parin has beautifully highlighted, but one thing which I want to say, that perception of the stress is very, very important. The last point which he said about, it's not the stress, it's a reaction to the stress which kills us, by Hans Eile. And fortunately, I've also quoted that quotation in the middle of my presentation. So how the perception of the stress is important, which is initiated in amygdala, and which is almost ready to fire, which evaluates the threat and signals the hypothalamus. And then the HP axis. The HP axis, which he was talking about, releases CRS, stimulates the pituitary to secrete ACTH, and finally adrenal cortex and adrenal medulla to release cortisol and other hormones. And then it triggers from this thing and then prepares for fight or flight. So all these things are happening. I'm not repeating it because he has beautifully highlighted that. Now, what I'm trying to say is that what are the various causes of stress in children with allergies? So one of the important thing is that what we see is that which comes up is the psychosocial factors. Is the children with visible conditions, what you were talking about, eczema, other allergic atopic dermatitis, may experience bullying or social exclusion, which impact their self-esteem. That is one of the major important reasons leading to the stress and psychosocial issues in these children. Then food allergies can lead to social anxiety, especially around eating in public or attending the school events. And parental anxiety about child's allergy may increase stress within the family dynamic. So how the parental anxiety is also contributing, it's like feeding to each other. So children are already having issues, self-esteem issues and the social anxiety, and the parent anxiety also adding to the fire. Then biologically, we know, the immune system dysregulation, chronic inflammation, which is associated with allergic disease contributes, which Dr. Parin talked about, leading to alteration in the brain development and function, affecting the mood regulation and behavior. And the third important point, we know our society is sleep deprived. And with allergy, their sleep gets more disrupted. So allergies often interfere with sleep due to symptoms like itching, nasal congestions, or asthma. Poor sleep exacerbates the irritability, attention problems, and emotional regulation issue. Two things which I've seen very significantly in my practice is that one is irritability and one is attention problems. So these two things get significantly highlighted and leads to various academic issues, scholastic issues, and the behavioral issues and the conflict which happens because the sleep is deprived also, and plus it gets disrupted also. So chronic stress due to allergies, we know what happening, it leading to dysregulation of the excess, impacting the various structures, as talked about Dr. Parin about the various various biological functions are getting altered, and it increases the vulnerability to psychiatric disorders as hippocampus, prefrontal cortex, and amygdala getting impacted. So there's an increased vulnerability to psychiatric disorders. And also, we know that chronic stress in children alter the epigenetic regulation, which he was talking about, DNA methylation part of stress responsive genes. So one of them is NR3C1 glucocorticoid receptor gene. It leading to blunted or exaggerated stress response and hence impaired emotional regulation. So what is happening is that this all is happening because of impact and stress in children, because of allergies in them. The stress leading allergies leading to stress. What is happening is that there is vulnerability to psychiatric disorders. There's impaired emotional regulation. There are behavioral symptoms, sleep disruption, irritability, inattention. The immune dysfunction, as he was talking about, increased pro-inflammatory cytokines, what he was talking about, 4, 10, and 13, that all is happening up, and Th2 is getting this thing. And response and metabolic changes like insulin resistance, central obesity, and cardiovascular strain, hypertension, atherosclerosis. So you see how much it is impacting the children. And then children are becoming more and more vulnerable to mental health issues, emotional dysregulation, behavioral symptoms, and there's underlying other mechanism with immune dysfunction, metabolic changes, and cardiovascular strain. So what are the signs? What are the red flags? What we should be, as an allergy specialist, as a pediatrician working with these children? Child will not come and say, I'm stressed out. Child will not say. He may only come out with allergies. But as practitioners working with this profile of children, we should look out for headaches, stomach aches, or other physical symptoms, which is not explained by the physical reasons, which we called as in a field like somatization. So headaches, stomach aches, and other physical symptoms, which we have seen, they keep on presenting with that. Irritability, mood swings, sleep problems, nightmares. They're avoiding school or social events. Increased clinginess or separation anxiety because they don't want to go to school. They want one of the caregivers always to present, more in smaller children. Trouble concentrating when they have sleep problems, when they're not able to sleep, when they have irritability, they're not able to concentrate, they're not able to pay full attention, and then leads to the poor school performance. And one more thing, the compliance to treatment, which Dr. Pramar was talking about, that yes, that they refuse to treat. They don't want the treatment. Their compliance goes down because it's a chronic condition going on. They don't want to go to the doctors. They don't want to take the medication on time. They have a poor compliance. That's what's coming up. And why? And they start expressing hopelessness. Nothing will happen to me. Nothing can help me out. It just keeps on going on. I'm troubled. I'm just so a lot of frustration keeps on coming up. And after that, what is coming is expressing hopelessness. If hopelessness comes anywhere, be alert. That's one of the biggest red flag signs in these children. That means the child is almost on the verge of depression or almost has gone into depression. So be careful for that point. One of the important things which we need to look into them. So it's not what he was talking about, this a father of stress research, Hans Hiley, it's not stress that kills us. It is a reaction to it. It is our reaction to it. The important word is our reaction to it. Maybe so everybody may react to stress in different ways, but how we react to it, that is the most important thing we have to look into it. Now, how can we manage the stress in children? That's very important. Though we working with these children, we have identified those red flag signs. Then what do we do? So two things. One, addressing the physical challenges of allergy and addressing the emotional response to allergy. In physical challenge, educating them and creating safe environment. And emotional response, normalizing the emotions, coping skills, peer connection, managing the parents' anxiety, stress, and professional help. So we'll address them step by step. So how addressing the physical challenges, the most important thing is that, especially for a pre-adolescent and adolescent or teenager, educating the child in age-appropriate ways. That's what we have seen. You educate the child, make him feel competent, make him feel empowered. Empowering the child, yes, you have allergy, but you can deal with it. You have allergies, chronic allergies. Yes, you can fight with it. We are there with you. So educating the child in age-appropriate ways about their allergy, how to recognize the symptoms and communicate clearly to adults or peers if they feel unwell. A lot of times they're not able to express their feelings. They're not able to express their emotions. So helping them to express clearly, so educating them about their allergy and to express about their symptoms and communicate clearly. So, and when we do that, it reduces feeling of helplessness or fear. So this, as I was talking about, this makes the child more empowered. That's what happens. Simultaneously creating a safe environment. Ensure allergy management plans are in place at school, daycare, or camps. So what happens? The child knows there's a predictability is there. He knows that, yes, I know when something happens, where I need to go. So ensuring the allergy management plans are in place, involving the teachers, caregivers, and peers in supporting the child. Keep emergency medicine accessible and teach older kids how to use them safely. So what is happening is that we are creating a safe environment and we are educating them. So that's about the physical challenge. Now, talking about the emotional response, normalizing the emotions. Let the child know that it is okay to feel scared, frustrated, or different sometimes. These are part and parcel of this medical condition. It's okay to have emotions. It's okay to feel, upset. It's okay to feel. We don't have to say, no, there's a problem. You're abnormal. No, it's okay. Everybody goes through it. And that's where the self-help groups really helps. Self-help groups gives a lot of power. Encouraging the open conversations about the feelings. I know everyone is so busy. They may be busy, OPD may be there, but the mental health specialist, psychologist, or mental health professionals working with the team, they can encourage the open conversations about their feelings. Let them share. Let them talk. Let them speak out. And sometimes with the younger kids, you can use stories, drawings, puppets to help younger kids express their emotions. Because once you're able to express emotions, you're able to normalize emotions, what is happening is that you're giving a channel to their emotions. You're giving catharsis to their emotions. That's important. Then teach them coping skills. Teach and regularly practice breathing techniques like deep belly breathing or mindfulness was what Dr. Parmar was talking about, that yes, various techniques are there. So one of them is breathing techniques is there. The mindfulness exercises are there. There's a lot of evidence are there for these techniques. Visualization, safe space imagery for younger kids. And it works very well. It works very well. What I've done with some of the younger kids, like 4-year, 5-year-old, I ask them to draw. And once I ask them to draw, I ask them to close their eyes and imagine. Clear? And also, for some of the kids, I've asked them to close their eyes and imagine as if they're holding the hand of their parents, holding the hands of the parents and feeling that warmth, and while they're walking with the parent. So visualizing them, mindfulness exercise, breathing techniques, they help the children and practicing these coping skills and problem solving skill for handling teasing or exclusion. So that's where it helps them. Also, encouraging a peer connection. As they go into pre-adolescent, adolescent teens, the peer connection is very, very important. Help them find friends who understand or share similar challenges. Role play social scenarios so that they feel more confident about speaking up, and support participation in safe group activities to reduce isolation. So in that way, we are making them feel that you're not alone, you're not left out. You're part of the bigger group. You're part of the adolescent peer group. You're part of the community. So encouraging that peer connection, and wherever they have challenges, practicing them through role play or involving the teachers and friends, so that they are able to become part of the bigger community. Another important, one of the most important, which Dr. Parmar also highlighted, is the managing the parental stress. Children often mirror adult emotions. He did highlighted how the maternal stress is coming from the pregnancy, and how it is impacting the fetal cortisol. It's impacting. So children often mirror adult emotions. Managing parental stress around the allergies can help them stay calm. That's important. We'll talk about it a little more in the next few slides. Seeking the professional support, making a mental health professional as a part of your team. Yes, if child shows signs of persistent anxiety, sleep problems, school refusal, or mood changes, consider consulting a child psychologist, psychiatrist, or child psychiatrist, mental health professional. The parents may be reluctant to go to mental health professionals, but if you introduce mental health professional, what Dr. Parmar was talking about, only 23% get mental health help, whereas 77% are not able to get help. So you see only 1/4. So that means introducing, and when you make the mental health professional as part of your team, and then tell them, yes, we are sending it for you for this purpose. Once you come back to us, again, we will take it forward. So in that way, their acceptance becomes more easy for the parents to accept that, yes, it's okay to go to mental health professionals. There's nothing wrong. It will only help in empowering the child. It will only help in making the compliance better. That's important. Now, coming to stress in caregivers, is that they have multiple causes. One is a constant vigilance for potential allergens. They have to constantly be vigilant, whether in the food, environment, multiple times, and this leads to chronic anxiety and exhaustion. It's almost like a burnt out for them, because we know that a lot of triggers are there across in everywhere, at home, in food, in environment, so many. So for them, it becomes quite challenging. Fear of accidental exposure. They're taking a lot of precautions, but there can be accidents, exposure is there. So this unpredictability fuels a sense of helplessness and worry. I've taken so much care, but still my child got an attack. I took on so much, then also he has gone into hospitalization. Why? Where am I at fault? And they start feeling guilty about it. Then social isolation. Because of that, they avoid restaurants, play dates, birthday parties, school events, because they're scared about, something may happen at there, and then they have to rush. So gradually they start isolating themselves. Then medical management burden, managing injections, reading every food labels, coordinating with schools and doctors. This daily mental load can lead to, again, caregiver burnt out. So that takes a toll on them. And emotional impact on the child. Caregiver often carry guilt or sadness for their child's struggles. So what happens is that they see those emotions on the face of the caregivers, and that impacts the child. And as Dr. Parma was talking about, when the stress increases, the outcome worsens. When the stress increases, whether it's because of their own stress or because of the stress coming from the caregivers, from the parents, it impacts the outcome. So the caregiver often carry this guilt or sadness for their child's struggles, and that really impacts them. And the financial strain, especially if work schedules are affected by caregiving responsibility. So you see, there are multiple causes. There are multiple, it's not one. The multifactorial causes simultaneously happening in day-to-day struggles, and plus managing the child's health also. So why a caregiver should manage their stress? Very, very important. Very, very, and because you can't pour from an empty cup. Take care of yourself first. You need to fill yourself. You need to have happiness. अगर आप में खुशी होगी तो आप खुशी दे पाओगे. आपके अंदर प्यार होगा तो आप प्यार दे पाओगे. आपके अंदर शांति होगी तो शांति दे पाओगे. So you can't pour from empty cup. You need to fill yourself with that calmness, with that happiness, with that peace. Then only you can pour that. Then only you can give that to your child. Otherwise, there'll be a lot of chaos in the house. There's a lot of chaos in the treatment, management, and the compliance. That's what, a lot of hopelessness and helplessness with there. But if you have a lot of optimism, if you have a lot of positivity, if you have a lot of that power, then you're able to give that power to your child. So important is that take care of yourself first. So what all can be done? Yes. So children co-regulate with caregivers. So what can be done is that we know that children learn to manage emotion by watching and attuning to their caregivers. Important word is that watching and attuning. A stressed, anxious caregiver may unintentionally transmit fear, hypervigilance, or emotional dysregulation to the child. Regulated caregivers help to build secure attachment and resilience. So what I was talking about, if you have an happiness, if you have a lot of peace and calmness, you're able to give that happiness and peace to your child. You're able to give a lot of resilience to your child. You're able to build that resilient capacity in your child. That's where important is that the caregivers are regulated. Second important point is that the caregiver stress affects child development, we know. The chronic caregiver stress has been linked to increased child anxiety, internalizing symptoms, greater likelihood of externalizing behavior. So internalizing behaviors like anxiety and externalizing behavior like aggression or defiance. It also leads to stress physiology dysregulation in children. So that's why it's important. It's also important because stress can undermine decision making. High stress impairs executive functioning, making it harder to problem solve, communicate calmly with healthcare providers, or advocate effectively for the child in school and social setting. Also modeling healthy coping by managing stress adaptively, self-care, boundaries, and mindfulness. Caregivers model effective coping. This teaches children to engage with stress in healthy ways and hence help in emotional development. What they see, they learn. What they see, how my parents, how my caregivers are managing the stress, they learn that. क्योंकि वो वही देख रहे हैं, observation learning. That's what the power of observation learning. So whatever difficulty, whatever the tough time may be there, but they see that the calmness in the parents, even in emergencies, how they're able to regulate. And that's what. So modeling the healthy coping. And caregiver well-being is protective. Multiple studies have shown that when caregivers are emotionally supported and less stressed, children with chronic health conditions have better treatment adherence, improved quality of life, and fewer behavioral issues and better emotional outcomes. So that's why it's important that caregivers, care is done, that caregiver takes care of themselves. That's important. Then only they can take better care of their children. And what all they can do? Yes, taking care of the physical challenges. So what caregivers can do? They can educate and they can be prepared. This is the important word, preparedness. The caregivers can be, they're prepared. They can learn about the allergy. They can have an emergency plan. They can practice using emergency medication and teach others how to respond. So this is about they're educated and prepared is there. Communicate, ensure everyone involved in the child's life understand the allergy and safety measures, whether they're teachers, whether they're peer group, whether they are other family members, extended family. And this helps to build a support network. This helps to make them believe, yes, things are in control. So this doesn't make them feel out of control. That's important. So the third important point is the practicing lifestyle adjustments, like establishing consistent routines around meals and activities to minimize exposure to allergen, meal planning, like prepare allergy safe meals ahead of time to reduce daily stress, and delegate shared responsibility with trusted family members or friends when possible. So by educating, preparedness, and communicating, practicing lifestyle adjustments, you are able to take care of physical challenges because this helps you to reduce your load, reduce your stress. Simultaneously, for emotional challenges, you need to take care of sleep, nutrition, exercise, self-care. That's very, very important. You yourself has to sleep on time. You yourself have to eat properly and exercise. You have to take breaks. Even short periods of rest or enjoyable activities can help recharge emotionally. You have to practicing of by caretakers by mindfulness and relaxation, deep breathing, meditation, yoga, reduce stress levels. Support groups, connecting with other caregivers. You need other people to support you in this journey of this, chronicity, where other caregivers who can understand your challenges can provide relief and practical tips, because you may not be able to get all the answers from the health practitioners. You may not be able to get all the answers on the Google. You may not be able to get all the answers in your own family, but other caregivers who have gone through this journey, when they share the practical experiences, they're able to support the family far, far better. Then professional help. Take counseling with professional if things get out of control. So self-care, mindfulness and relaxation, support groups, and professional help. So in the end, I just want to say, stress is not the enemy. It is a signal that we are being called to grow. That's very, very important. A lot of times, stress comes to bring best out of us. Stress comes to enhance the competency and to take the right steps. So thank you very much. Thank you once again to Dr. Neeraj and the IAP chapter of Allergy and for giving me this opportunity. Thank you very much.
Thank you, sir. That was a wonderful session. As you rightly said, we cannot pour from an empty cup. So I think parents and doctors, we self have to realize that when we face stress, it's a choice that we face, that either to be stressed out or to try and be calm. I think that is easier said than done, but then thanks to what you have said, we can take it one day at a time, one step at a time. Now we go forward to look at the life of an allergist, life of a doctor. We are all very familiar with the words which are said by William Davies that says, "What is this life full of care? We have no time to stand and stare." I think in today's fast-paced world, in where each one is trying to achieve more and more to outcompete, we have, especially allergists and all other medical fraternity for that matter, have got a very stressful life. So I call upon Dr. Manushree Gupta, who's a Vice President, Delhi Psychiatric Society, to have a few words. Over to you, sir.
Yeah, thank you, Alan. And first of all, my gratitudes to the IAP for inviting me to chair one of their very important sessions. So as Dr. Deepak Gupta's last session, I was listening very keenly. He has stressed about the how to balance stress and depression in the caregiver of people who are suffering from allergies. Now, this is an even more important session, how to balance work, how to bring about work-life balance in the allergist or the doctor concerned. So there has been recently a lot of talk on how to maintain work-life balance in all professions. The 70-hour work week, the debate around it, and of course, we know as part of the profession, I know that how doctors are the least caring about their own work-life balance, and they often neglect how to achieve that work-life balance. So it's a very delicate balancing that requires, because the sense of duty and motivation towards their profession often causes us to ignore our own health, right? And quality of life that Dr. Sankal Jain is a very dear friend and a valued colleague. I know him for the past 3 or 4 years, and he would be a very appropriate speaker. Why do I say this? Because he is one of the young upcoming psychiatrists. He belongs to Gen Z, I believe, and there has
Still a millennial, sir.
okay. I think yes. I just missed being a millennial by 1 year, but this debate around Gen Z, millennials, and how the traditional doctors or professionals maintain work-life balance. We have gone a complete sea change in terms of how society is evolving with the recent advent of the mobile technology, internet, and of course AI. So that has overtaken our lives in a significant way during the last 22 decades or so. So over to you, Dr. Sankal Jain. I believe you would do justice to the session.
I'll surely try, Dr. Manushri. I thank you, all the faculties here. Dr. Deepak very precisely spoke, and before Dr. Deepak sir also mentioned about the allergy and mental health. Here, to begin with, the quality of life of the allergist and their family members, work-life dynamics for pediatric allergists and specialists. We have to fundamentally understand what quality of life stands for. So to begin with, we let's understand what quality of life constitutes. So if we understand by the WHO definition, that they say that QOL is an individual's perception of their position in life in context of their goals and expectations. Now, when we speak about QOL, that is QOL in our context, spans physical, psychological, social, economical, and spiritual domains. It is not just impacting the allergist, but their family members. So, when we say quality of life, we are not only talking about stress and hours, but we have to go a little deeper also, because generally at a superficial level, most of the people think that quality of life is all about stress and hours. Once we go deeper, I think we will be able to understand what quality of life actually means. Now, here are two uh, infographics which very well explain the domains of quality of life. Once we aspire for so many quality of lives, but what does it is made of? We have to see into it. So, quality of life basically is also composed of our social interactions, our religious and spiritual statuses, our economical and vocational status and factors, psychological status and well being, and physical status and functional well being. And if we expand our quality of life, we then the overall experience of life, material living and conditions, productivity, education, health, leisure and social interactions, economic and physical safety, governance and basic rights, natural and living environment, they all are so many other factors as well, which constitute a good quality of life. Now, if we as a doctor, which is a high stress branch, and allergy, will come to the aspects of allergist in a bit. Once if they are stressed, of course, it the compounding effect is presented in the family members as well. Now, here is another infographic which again explains that there are physical domain, psychological domain, social domain, and environmental domain. Physical also includes activity of daily livings, mobility, pain and discomfort, sleep and rest, and work capacity. Psychological includes bodily image, appearance, negative feelings, positive feelings, self-esteem, spirituality, thinking, learning, memory. And like that, we have social and environmental factors as well. Now, once we come to the life of a allergist, there are so many different challenges that in today's world pediatric allergists are specially facing. As of the comparative references that we went through, we see that allergists have also have to work long hours. Their screen time strain is also there, and poor sleep during seasonal peaks are there. They are one of the branches that have one of the most seasonal peaks, and their burden of working increased drastically. Now, what is the impact on their family is that their sleep also is disturbed, and difficult assessing healthcare is seen. Overall, there is a physical fatigue spillovers into emotional exhaustion. As Sir rightly said earlier, that so many times the parental emotional overload is implicit in the children. In the same way, when the doctors are not themselves feeling well, it is as a defense mechanism, it is projected into the family members as well. Now, when it comes to psychological status and well-being, we have also seen that allergist, as compared to the allergist in UK and US, Indian allergists face higher burnout, anxiety, and ethical distress for prior mismanagement. What I mean to say is one of the most common problems that allergists are facing in India, and especially tier 1 cities, when they are referred from tier 2 and tier 3 city allergist or pediatrician or physicians, they often see that the patient has been grossly mismanaged. However, uh, keeping the sanctity of the ethical dilemmas, they cannot do medical jousting. So this creates additional pressure on the allergist, and therefore much more ethical distress is there. Then this distress further is again seep down into the family, which result as a secondary stress, and the allergist decreased emotional availability because of all these paraphernarias and these paracentric burnouts and anxiety. Now, what is the challenge that they face? That there is no systemic space to process emotional load. So we definitely have to give them time, and we have to give enough space, and we have to work on a more comprehensive systems so that we do not fall into these traps. Now, the next is social interactions. Allergists are often very much, isolated from peers for the fact that they the patient reaches them at a very late state, and they have a limited social time. Most of the in pediatric allergy, most of the allergies are also now taken care by other pediatricians or the physician itself at a tier 2 and tier 3 city, which causes them a poor disconnect with the allergist, and therefore this miscommunication puts a further pressure on the allergist, and the pressure from the families of the children is enormous. What is this implication on the family? That there is again missed family time and their unpredictability. So the impact is that emotional detachment and resentments within the household. I in my personal counseling, I have managed many doctors as well. The stress ultimately impacts, it goes to the children, or it goes into the wife or in-laws, or the work performance is significantly affected. Now, coming to the economic and the vocational status, today allergists face one of the biggest problems, that allergist as a private practice is still quite unstable, not because of most common reason is that it is yet to be identified among the other peers as one of the most important branches, because it is also cannibalized by other uh, streams. And then one of the problems is that the the quality of the test in other spaces other than primary tier 1 cities are poor quality. Now this has much more higher implications because allergist has to become a generalist then, and they have to make the financial ends meet. They have to expand their practice. Now this otherwise causes career compromises by the spouses and financial unpredictability. So as a result, there is much more stress amplification through financial strains. In the same way, we have to understand that it's not only about their way of practice, but religion and spiritual status as a quality of life indicator. Allergists, because of their problems, have less time for the rituals, and there is loss of meaning. So as a result, disconnect from the inner purpose and spiritual fatigue is also reported in some of the researches. Now, one of the important problems that one of allergist and the quality of life that impacts for an allergist is their allergist may report career satisfaction, but they feel personally defeated. Doing well professionally is doesn't mean living well personally. So we have to understand that professional and personal are two very different things, and work life balance is exactly what we speak about, that doing professionally well and living personally goes two hands parallel to parallel. Now, one of the most we often come across that urban allergists may lack clean air despite financial stability and limited allergy infrastructure in India. So, no matter we are living in Delhi, and no matter how good allergists develop treatment plans, but the allergy and the urbanization and the new age technology will keep bringing new age lifestyle will keep bringing new and new allergy. And there is also a problem that is faced recently is, or the upcoming thing is, that limited allergy infrastructure in India. For example, even today epipens are one of the most difficult things to procure, even with the prescriptions. So allergist has to live with the expectation of the patient. Allergist have to give the diagnosis at a very small period of time. They have to deal with the sub quality standards of reports, and then they have the peer pressure, they have the pressure from the parental expectation of treating something chronic in a very short period of time. So these are one of the most social pressures that allergists definitely face. Now, one of the another problem that allergists are facing today is that allergists are not recognized as a specialty in India. We still do not have DM courses for an allergist. However, these courses are now coming up as what do we say? Not DM courses, but fellowship are there. But still, allergy has to be recognized as a much niche branch in India, given the fact the lifestyle changes are there. It has to come to the paramount importance. Now, burden of proving relevance to one's own field repeatedly because of the overlapping nature of the allergy, it is definitely causing a lot of stress, and therefore it relies down into the quality of care of the allergist as well. Now, I may be factually wrong here, but most likely, as per the papers, we have read that there is no formal Indian allergy subspecialty program yet as of now into the educational programs. And most of the allergists have to learn, and by self-directed learning causes, and which further causes financial pressure to them. Now, because of this, allergists are also given much of the administrative task, which also impedes their learning, and therefore they have very few time to enjoy their family holidays, and their hobbies are often shelved. So this is where I implore that we have to find work-life balance, and we have to take care and give priorities to things that matter to the matter most. In the same way, there is financial and economical safety concerns are there. There is variable income and legal risk from the patient dissatisfaction exposes the allergist to the maximum. They have very high expectation and turnout and the result of the illness. However, allergy is often in the labels called as that iska to bhagwan hi malik hai. You understand? So most of the allergies are also, we don't know what are the exact reasons. For some we know the reason, and there is a definitive treatment bottleneck that creates once we start on immunoglobulins. So there are certain such bottlenecks that causes much more physical safety and economical safety problems to the allergist. Now, one more thing that has recently come up is that uh, allergist or even the medical fraternity, they have the mental health leave is yet not recognized, and no protection from the abuse is there. And therefore, there is much more ethical fatigue due to silence about poor previous care is also there. Now, coming to natural living and environment, Delhi NCR allergist irony of treating asthma is in the world's most polluted city. So I can definitely extrapolate to understand that what kind of burden the allergist may face, and therefore health hazard increases the emotional burden of our own allergist and the pediatric allergists that they are dealing with. So, what I want to tell is that the quality of life must be shared. The allergist quality of life is not equivalent to the individual's issue. Rather, it is a systemic and the familial issue. And the institutional, relational, and self care solutions must coexist. What I mean to say is that there has to be a system not only for allergists but also for the entire fraternity to make sure that are they able to capitulate all the domains of quality of life that I previously shared. And prioritizing quality of life enhances not only the patient care but also the doctor's well being. In the last, what I want to tell is that the well being of the healers shape the healing. A fulfilling doctor nurtures not only patient but also a peaceful home and a hopeful team and a healthier world. Thank you.
Okay, Dr. Sankal, that was a very insightful talk where we learned not only about the quality of air that we have to deal with, but how it also but also a quality of life which we face. We all know that, as sir said, the work-life balance is not something that we prioritize what is our schedule, but of course we have to schedule around things what we prioritize. So we had very insightful talks, and we have learned a lot this evening. So I put the forum open to questions from our audiences. Please type in your questions in the chat box. To begin with, I would like to ask Dr. Deepak, sir, what is meant by brain fog or brain allergy, and the risk and the correlation between autism and allergy? Because there are certain reports that say that these two are correlated, and that severe allergic symptoms are associated with higher grades of autism. So, would treating allergies better control autism? What would be your take on it? Any of the panelists like to talk about the brain fog and brain allergy? So, Vedantam, you're with us this evening, and Sir has spearheaded a lot of education on regards to allergies in India. He's also done a lot on sleep, and Sir is an ardent practitioner of yoga. So, I would like to invite Sir to throw in his insights on how do we connect all three to manage allergies, manage stress, which can also affect allergies as well as our skin. Sir, over to you.
Can I speak now? Okay. First of all, and this is Dr. Vedantam, and thank you so much for conducting this very useful forum today. Especially want to thank Neeraj IAP Group for putting this very, very essential type of discussion today. Because not only allergists, all of us in medical profession need this off and on, reminding ourselves how we need to live in the midst of all the things happening around us. Thank all the participants today. Just have a few comments. First of all, our profession is probably one of the most noble profession. There is no doubt about it. I have been in this profession longer than many of you of your age, because I started this about 55 years ago, maybe almost 60 years ago. I've been exposed to this profession even as a child because my father was a private practitioner, highly compassionate guy. So since childhood, I have seen this profession. So the one I would suggest all of you to do, first thing you get up in the morning, thank God that you are a physician, that you are in the health profession. Thank God. Thank God that you are given an opportunity to help others. Thank God that you are equipped with knowledge to do this. Those are the first thing you get up thanking, not complaining anything. Then do something that is good for yourself first. Before you start the day, do something for yourself. That means you have to get up early to do that something. I get up at 4 o'clock, 4:30. I know many of you get up around the same time. Many of my professors in the universities that I have served, they all work, they all get around 4:30 because these busy professionals get busier and busier and engaged as the day goes. So the only free time they have is early morning, and everybody is sleeping. You should be awake, and that is a quiet hour. And you can do anything you want at that time. You can meditate, you can study, you can go ahead, answer your email. The mind is clear. You do your yoga, meditation, whatever. And some people say, I sit doing nothing. That's fine too. So that means you are giving some time to yourself. So your battery is getting recharged. So you need to recharge yourself. Otherwise, you will get discharged completely. The third thing is once you do that, you start working in your offices, couple of things you need to know. One, from morning till evening, from 8 o'clock in the morning until 10 o'clock at night, you are surrounded by anxious people. You are not surrounded by people who are happy and trying to crack jokes with you. These are anxious people looking for answers, very agitated people, misinformed people, people who have got 10 different impressions because they have seen so many other doctors, and they are confused people. So what is your job? Is to convey the right message, to tell the truth. Tell the truth. And also you should always believe in one thing, never bluff. You should know one sentence with 2-3 important words. I don't know is a very important sentence. Very, very important. Never try to bluff something to the patients, because one day they will find out, or you yourself won't feel good if you say something. So if you don't know, just say you don't know. If you know of somebody who can do a better job, refer to them. So that is very important for us to be honest and tell your whatever knowledge-based information you have or evidence-based information, share it freely. And share it freely so that the patient gets educated. A lot of our patients, I tell you, in the field of allergy are not coming to you for pharmacotherapy. Don't get me wrong. They are not coming to you for new drugs. They have already been through all those drugs except biologicals. Your prescription is not a major part of your care. Your major part of your care is compassion and education. Listening to the patient. That is, when you take the history, listening to the patient, giving your time to the patient, and educating the patient is what we should do. Because I know that I have been a consumer as well as a provider. I myself go to the doctor for different reasons. And I make a small list and I wait anxiously for those 10 minutes with the doctor. I waited 3 months to see the doctor. So these patients who come and see you are anxiously waiting for 3-4 months to see you. And you need to provide the same care that you would provide to yourself in those 15 minutes. Look in their eyes, listen to their pain, listen to their agitated mind, agitated words, and never get angry with the patient. Never show your, because as physicians, you need to know that medical profession is a very, very powerful profession. Even Prime Minister, President of the King of the country has to listen to you. It's a very powerful profession. So with that power, you have to use it very sparingly and properly. And the only way you can use this type of power is by compassion. By compassion and love, you can win over all these situations. So these are some of the general things you should do. It does not matter which IL-10, IL-3 that is working. The patients are not interested in your degrees and mechanisms. They want relief and they are looking for some good care, somebody to listen to them and give them good advice. So this human part of this specialty, allergy, especially allergy, is a field which is relatively young field. There is a lot of more misinformation about allergy than any other field I know. There is not that much misinformation about cardiology, not that much information about gastroenterology, not that misinformation about rheumatology. Many lay people know more about it, but coming to allergy, unbelievable amount of misinformation. So they did a survey in USA to find out how many health providers the patient would have seen before seeing an allergy doctor. Average number 13 doctors, 13 health providers before they come and see you. 13 types of information have been given. 13 types of suggestions have been given. Many of these suggestions are misinformations. So most important job for you is not prescription, education. And I will stop here and educate your patient honestly, compassionately, with love and care, and you will be quite successful and you will feel good about it. Thank you very much.
Thank you, sir. That was really informative talk from you. I mean, we tend to see allergy or we tend to see medicine only from our perspective. You have brought in the patient's perspective also. I'd like to ask, sorry, I'd like to ask Dr. Parin a question. Dr. Parin, can you give us some idea, some comment on what is brain fog? And I would also like to ask you about managing positive stress or exciting events that may happen in a child's life and those effects of those events on a child's allergy, maybe a party, maybe a family trip, a birthday party that is coming up. How does that affect?
Okay. So first of all, let me talk about brain fog. So this is not a very commonly acknowledged symptom or clinical feature of allergies, but there are so many causes or factors which lead to brain fog in allergies. Like we say that histamine is a very important mediator in allergy, and our CNS has all the 4 histamine receptors, H1, H2, H3, H4. They have different mechanism in our CNS. So, and there are multiple mechanisms why patients develop brain fog. Some patients with non-celiac gluten sensitivity have also reported to have brain fog. I personally know one of the patients who immediately develops brain fog, confusion, memory disturbances, fatigue within 24 hours of consumption of wheat. But again, that is not a very much recognized phenomena. Only scattered case reports, some case control studies are there. So yeah, but it's something which we know more about after some further larger studies. Regarding positive stress, what I believe is that both stress and allergies, they cannot be generated over a few days or weeks. Okay, so both are long-term processes. They develop over months or years. So once a patient is diagnosed with some chronic allergic disorder, we should emphasize the importance of stress management, whether positive stress or negative stress, to the parents. And what I practically do, because I'm a qualified yoga and music therapy practitioner also. So depending on age of the patient, I emphasize importance of stress. I tell them that stress can lead to exacerbations, can lead to worsening of control of the allergic condition. And so start something for stress reduction, like Dr. Deepak Gupta sir has mentioned so many interventions which can be age appropriate. For example, if a very young kid, then something like listening to music regularly, soothing music, nature music, that can help. And that mental imagery, safe space imagery, that help. If an adolescent, then yoga or mindfulness can be talked about, or at least 1 hour of outdoor activity, physical exercise regularly, which is lacking in so many urban patients nowadays. So that is also a very important stress buster. So I always suggest to emphasize importance of stress-free lifestyle, or at least some lifestyle modifications that help them to manage stress, whether positive or negative. And when you especially mention about events like birthday party or travel, if it is a food allergy, yes, we are concerned. We can teach them alternatives, which we can teach them to read labels and how to prevent allergic reactions, and they require some additional mention.
Okay, sir. That was really helpful. Dr. Deepak Gupta, we talk about managing stress in children to teach children how to manage stress. One of the ways which we say is to teach an infant, to teach a child self-soothing early on in life. But especially today, nowadays on social media, we have a lot of videos saying that self-soothing may actually be counteractive. You have only a certain number of years to spend with your child. Do not let them self-soothe. So, what is be the ideal age to start teaching a child to manage stress, and how should that be done?
See, lot of this depends on the developmental age and the intellectual levels of the child. That's a general answer, and that's something which you will read everywhere. But I say that you can start teaching your child even as young as 4 to 6 years also. You don't have to tell them that this is stress, it will come, do like that. No. Teach them healthy lifestyles. Teach them to share. Teach them to share their emotions by early. Put them into healthy lifestyle, what Dr. Parma was talking about, exercise from early age. Sleeping on time so that they get adequate sleep. Minimal use of screen time. So minimal use of screen time is there, exercises are there, sleeping on time is there, and spending time with them by sharing. So they also share with you, you also share with them. So when you're doing with 4-year-old, 5-year-old, 6-year-old, the vocabulary may not be too intense, but the vocabulary may be limited. But yes, that is a time the child starts learning that it's good to share. It's good to share about feeling, about emotions, about happiness, about sorrow. What happened in school, somebody had hit them, somebody had bullied, somebody made fun of them. So they may not be able to identify that this is the real stress. They still the jargon of stress is not come into their life. So we don't have to make them feel little hyper about the word stress. Stress has a lot of lot of myths and things are there. So don't make them feel oh my God, stress is there. Teach them, let them grow. Teach them, let them grow. The stress, depression, anxiety, all these have become very, very social, and the metro words are there, according to me. And there is no answers to it. Rather than teach them answers, make them practice those answers, make it like a routine. So if they're doing it then what will happen? They'll be able to. Now, once the allergy problems coming up and it is taking a stress on them, they will share their emotions. That is the time you want to teach them. You want to teach them some way, it's like any techniques. Whether it's a holding, whether it's a jumping, whether it's a drawing, whether it's visualization, all depends. So my answer in a nutshell is that teach them healthy lifestyles as early as possible, even to 4-year-old, 5-year-old. And then, if required, once they get 7 to 8, 9 years old, if you feel the intellectual levels are appropriate, then tell them, yes, stress can bring the allergies or these medical problems can sometimes bring challenges. And this is the way I have been dealing it. I want to tell you. But then if you want to teach them, then you have to be a role model. That means you can't be anxious and teach a child not to be anxious. So in that way, gradually, it's a journey. You just can't open a book and say, learn stress management. No. Like this, manage this thing. No. You have to work with them, for them, by them, and with them. That is the answer. I hope it makes sense.
Yes, sir. Thank you. That brought a lot of clarity. There was another question about stress being taboo and how to identify or what are the silent pointers towards stress. But I think Dr. Deepak Gupta has explained that very well in his lectures as to what all are the silent things which a child might go through and what we should, as parents or as doctors, observe in a child, and they can be the silent pointers towards stress. But when you come to adults, so Dr. Sankal, can you point out to us like what are the self-assessment tools which we can go through? Because if we ask a parent, "Are you stressed?" or even a doctor for another matter, we tell them, "No, you are stressed," or you should take some time off. They will say, "No, we are not stressed. We have no stress." So what are the self-assessment tools? Because the parent or a doctor may not open up to someone else, but what can they do by themselves to kind of identify what they are going through?
Alan sir, you have asked a beautiful question. Here, I'll tell you two different ways. One is self-assessment by your own knowing, as in whether you are mentally healthy. Actually, most of the problem is we see mental health in a very dichotomous way. Either one is mentally healthy or one is mentally ill. We don't understand that in between there is a spectrum called as being mentally unhealthy. At that point one has to realize whether now am I suffering from the issues. Having depression is a normal phenomena, having anxiety is a normal phenomena, having anger is a normal phenomena. But once you or the family member starts to suffer because of this phenomena, I think then intervention is needed, and one can perceive in themselves that I should reach out to a specialist. However, there are some scientifically validated scales as well, that is called as PSS and DAS-21 scale. One is a perceived stress scale, and DAS basically measures depression, anxiety, and stress scale. And these are self-reported only. So if one can go through them, I think they can definitely figure out that are they having, or are they now the sufferers of the problems as well. So PSS and DAS-21 can be conveniently used, and they are readily available over the internet as well. And therefore, you can take it further.
So as we all know that, do you also think that stress management, apart from, I think we doctors need to learn a lot more apart from just pure medicine. So should stress management also be a part of our curriculum?
Definitely stress more importantly, rather than stress management, I would like to rephrase it as coping capacity building should be more importantly emphasized rather than labeling it as stress management. See, stress is a part of daily life, and stress is, you can say, state of mind as well. What I enjoy, I will not feel stressed despite the gravity of the work. If somebody doesn't enjoy it, then they will feel it as stress. So from the childhood, taking cues from what Dr. Deepak sir has mentioned in his sessions, taking cues from that, I would encourage that the more coping resources that we develop from the childhood and actively inculcate in our adulthood as well, better the stress management already is. There is a very famous quote regarding this: a person with a hammer will see every problem as a nail, isn't it? So the more armamentarium we develop in our coping resources, the more easy for us it is to deal with the stress, right? It is only when the coping resources are exhausted the person enters the domain of the mental health issue. Otherwise, till then the coping mechanisms are working, the illness doesn't surface, or the health issues doesn't surface, right? So mental health has to be taken in three ways: promotion of mental health, prevention of mental health, and treatment of mental health. Most of the practices that we discuss are very good for promotion and prevention. Once the illness happen, then the treatment has to go, and relapse of treatment has to be focused, relapse of illness has to be focused, and adherence to treatment has to be taken care. But the other things that we are discussing here are more for the promotion and prevention of mental health. I hope that brings much clarity to our audience today.
Thank you, Dr. Sankar.
Dr. Alan, can
So
I
we
ask
all
you?
know.
Dr.
Yeah,
Alan,
sure,
can I
sure.
ask a
Yes,
question?
sir.
Yeah. So, Dr. Sankar, I would like to ask one question to you and to all the esteemed panelists. When I was doing my fellowship at Great Ormond Street, so I have seen that there was a system in which all the fellows, on a weekly basis, a psychiatrist usually used to visit our unit in intensive care, pediatric intensive care, and psychiatrists used to speak to the fellows that what is happening, what is your problem, how are you feeling, and all those things. And then psychiatrists try to screen out that, okay, this particular person or this particular fellow needs extra time. And then that particular person, they try to give a individual time, individual counseling. And that was so impactful that even, like, for an example, some fellow is unable to adjust because there is some language issue, there is some dietary issue, different issues which are there, or probably some racism is going on, so whatsoever is going on. So this particular fellow is difficult to, you can say, like, adjust or cope in that particular environment. And then at that particular time, he's unable to speak because the problems are related to the colleagues or to the consultants or whosoever. Then he was never given that opportunity or window to speak about that. And then these people, these psychiatrists, used to give that window, and they let the person to speak. And then when the person speaks, then at that time they come to know, okay, in this particular unit this problem is happening. And then this was more confidential also. So do you think that these type of exercises should be done, can be done in India, in our hospitals, and from Delhi Psychiatry Society or from your Psychiatry Society point of view, are you people trying to have? Because I personally feel that, like, for me or for my colleagues, definitely we all need to speak, but we cannot, because there are a lot of issues, lot of fears among ourselves. We cannot speak about that. So do you think that any particular type of exercise or any particular, you can say, like, a routine type of a thing can be instituted from the society point of view to the hospital management or to the hospital? Is it possible?
Sir, very beautifully put, and you have highlighted an important problem. But as I take many corporate sessions, there we come up with a solution of integrating an entire team. We have to make sure the unit functions as a unit and not a collaboration of single individuals, isn't it, sir? If I wholeheartedly promote the idea that psychiatrists should be involved, but we at the end of the day we will definitely face a bottleneck because of the limited time availability and the divided responsibility of a psychiatrist, right? So if we manage a protocol SOP of the communication system, leadership, and team efficiency, and sportsman spirit in the entire team, and then once in a blue moon a psychiatric intervention is needed, or monthly it is needed, then a system can be planned. But if we say per week I think this will bring out a bottleneck. So instead, we can focus on a team building exercise, a better communication strategy program, and a more strategies that make unit very cohesive and supportive towards each other.
I definitely understand and definitely agree. But what I was saying is that if we are having some mechanism, and at that time, I'm not saying weekly. I was just giving you an example of weekly in UK, but I'm not saying weekly here. But whatsoever, at least even if once in 2 months, once in 3 months, but there are some sessions which can be done
Oh yes,
for
a
the
beautiful idea,
post
sir.
graduate students. Yeah, then that
Yes.
will be really helpful. Even if you are unable to do it individually, even if you can probably club them together and then give them a session.
I would request rather Dr. Manushri and Dr. Deepak sir to pitch in this idea. We have very beautifully put, sir, an important highlight of the problem.
Dr. Neeraj, I feel it is something which is should be a mandate, and it should come from the top. And if it comes from the top, like from the directors or from the chairman office or from the directors, it comes up, and then it percolates down, and then it happens on a regular basis. Then gradually the faculty, gradually all the professional also may be able to overcome their hesitancy and inhibitions. Because a lot of time, initially what will happen, especially when everybody is so busy in their practice, everybody is so running here and there. So when it keeps on happening on a regular basis, and when it is coming to the top, gradually it become a regular process. You're right, once in a week, once in 15 days, once in a month, all that can be worked out. But then the consistency is important. And what you're talking about, great Ormond, when it's happening the person is designated, he does it on a regular basis, then gradually fellows also starts coming up. Yes. And then everything remains confidential. That's another part. So it is not, you just can't talk about that, in the corridors or in the lift here and there. So confidentiality is maintained, consistency is maintained, and gradually the professionals will start having confidence in the mental health professionals. So if that has happened, I'm sure it is need of the hour. Every second person, and with doctors having so much of load, they really required this input. I can say, why only pediatrician? Why only intensivist? Even psychiatrists also need their own mental health professionals. Dr. Parmar is smiling. So every in US, other countries, they have therapists have their own therapist. We don't have a therapist to like that. And in here, we don't have that culture. So the culture has to be created consistently. And I am sure that can happen. But yes, somebody has to initiate.
I absolutely agree with you, sir. But once again, I would like to differ a little bit, because what I feel is that the problem actually happens when the top people are unable to, you can say, like, understand what is happening at the fellow level, and when they are not getting the situation, then at that time they will not feel the need for doing that. So that is why the problem is happening. So what I'm saying is that the top people will definitely listen if the people like you, people like your reputed society, if you make the noise, if you start making the noise. The same thing is happening at our chapter also. Like, we are making the noise, and that is why we are trying to, you can say, like, hit at different levels, and up till a certain extent we are able to achieve something. But at least the noise should start from someone. So we should not wait for somebody that, okay, that particular person should pass an order and then only the things should happen. I personally suggest that in our own institutes, if we can just conduct a free, you can say, like, a session for all the graduate students and the postgraduate students, and they see how the response is going on, and let's submit that report to the you can say, like, to the higher authorities, and I'm sure that they will be ready to help. But the problem needs to be taken to them, and the solution needs to be taken to them. So
I agree with you that somebody has to bell the cat, somebody has to initiate.
yes,
You're right. Because they may not have the vision.
yes,
What I was trying to say is that we initiate, but we get their support.
correct,
That's what I
absolutely,
meant. And
absolutely.
we initiate, then we get support and do consistently. In the end, we only have to do it consistently. They won't do it. They will only pass the orders only, but we have to start and say, yes, sir, we want to do it. And then we do it consistently, and gradually, it just starts happening it. But yes, it's the need of the hour. Doctors and mental health professionals has to work very closely, because every second person, every second doctor, needs inputs from mental health professional, I believe.
So I would like to request from our IAP Allergy chapter point of view to Delhi Secretary Society, if you feel that this can be done and this should be done, so please make some initiatives, some initial things. If there is anything at any point you feel that we can help, we are definitely there to help you for any particular thing. So thank you very much for that. Dr. Allen, please.
Yes, sir. I truly believe all of us as mental health professionals, as healthcare professionals, we do require mental health from time to time. And now, as Dr. Nishant has pointed out, the bigger problem which we face is making the patients and the parents accept that mental issues can directly affect or can directly originate from allergies. And when we try explaining that to the patients, the parents do tend to overreact, and that sets in a vicious cycle and makes things worse. So, how do you all suggest we approach this, and what would be the best way to deal with this?
This question is directed to?
To any one of the panelists. So, anyone who can take it up.
I would like to put in 2 cents of my experience. Very recently, we have developed this script, where we say, see one of these similar problems. So, in our OPD, what we do is we educate the parents first that what is a psychiatrist doctor of. They have this vague idea that doctors, psychiatrist is a doctor of brain, we are doctor of uh, s- and some vague things they will say. So I generally tell them, first of all, you have to learn that I'm a doctor of mind, and in more easy words, we are the doctors of the software of the body. Now if there is a problem in the software, this will manifest, it can manifest in any hardware issue. It can be associated with patient having inflammatory bowel syndrome. It can also manifest in dissociative disorders. It can also manifest in increased BP. It can also manifest in diarrhea, constipation. In the same way, a stress over your own psyche or the software will definitely affect or in manifest in, can also manifest in illnesses like allergies. I think with this approach, when we reach out, we have seen there is some level of acceptance in the parents' behavior and parents' understanding of the mental health.
Okay, thanks a lot, Sankal. This was a wonderful session. We had a lot of insights on how to connect what we can see on a clinical basis and what we cannot see and what we have to ask our patients. So right now, I would like to invite Dr. Pankaj Verma to put in a few closing remarks. Sir is the General Secretary of the Delhi Psychiatric Society. Over to you, sir.
Thank you, Dr. Allen. At the onset, I would like to thank Dr. Neeraj Gupta, Chairman, Allergy and Applied Immunology Chapter IAPP, and Dr. Pankaj Kumar, DPS President, for taking up such a wonderful topic. We have been teaching our students about psychosomatic illnesses, about asthma, about allergies, uh, about food allergies, and in our own way. And but I did not know how to the other side of the mm, coin, how you people are dealing with it. So I think this is a very great beginning, and more often we should interact so that we'll be able to exchange notes about how to do this. And like psychoderma, we might someday have a psycho allergy arm of the this medicine also, so that it helps patients to improve. Uh, it was wonderful to hear Dr. Parin Parmar, who talk about it as not the stress, but the reaction to the stress killing us. He wonderfully explained about allergic rhinitis, asthma, urticaria. He also talked about a vicious cycle about stress and allergy. It was wonderful to hear, Dr. Parma. I thank you for giving such a wonderful insight. I would like to thank Dr. Deepak Gupta, who said, "You can't pour from empty cups." He has been ex-president of DPS himself, who beautifully explained about the problems faced by the patients and the caregivers, and also gave the practical solutions. Person of his experience, we always learn from you, sir. Thank you for giving us such a wonderful talk. Now, coming to Dr. Sankalp Jain, I think I'm hearing him for the first time. He talked about the most pertinent topic of today, that is quality of life and work-life balance. What are the work pressures and what are the decreased social interactions doing to the physicians? While listening to him, I was reliving the journey of what we psychiatrists as a professionals had to undergo. That we were not being taken seriously even till the 80s and the 90s. But here we are now. People are taking us seriously, and he also talked about wonderful thing, what is called mentally unhealthy. See, what he was discussing was prevention and promotion of mental illness. I would like to thank Dr. Sankalp Jain for giving us some insight, and it was a wonderful, very pertinent topic. Now, coming to Dr. Neeraj said, psychiatrists should more often be involved than. I was just listening to Dr. Deepak Gupta also. We have been trying to do this with our students, especially when in today's life, students are facing the stress day in and day out, and few of us, our younger colleagues, are committing suicide also. So we started a student welfare center kind of a thing. Though Dr. Manushi is in charge of that, for years together, nobody turned up. Then 2 years back, okay, let me tell you, 5, 6 years back, we went to the MS to do a study on what stress is doing to the students and their perceived stress when they join, and after 1 year of joining, how they perceive the stress now. But it was rejected outrightly. You don't talk about stress, don't talk about suicide. But now the change has, there is so much change that we have been conducting suicide prevention workshop for last 1.5 years for all the students from MBBS to the PGs, even SRs, and very soon we'll be starting the stress suicide prevention workshop for the other workers also. So this is what we are doing, and there is a very big change from not accepting even for the study. Now we are conducting it on a regular basis. So yes, I agree with Dr. Neeraj Gupta that if we start somewhere, we'll reach some level after a few years of struggle. Yes, we'll be successful. But on the other hand, we have to understand there is a still block among, not among the patients only, among the doctors also. When we say that patient will not come to a psychiatrist, see, when it is a promotional of mental health, it is fine. When it is a prevention of mental health, it is fine. But when it is about the treatment, treatment does not need a choice. It has to be treated. There are ways for treatment, whether it is pharmacological or whether it is non-pharmacological, but it has to be treated. It is like allergy only. If a patient comes to you half treated, or if patient leaves in between, so the allergy will reoccur. So the similar is the mental illness. So I could find many commons between the two streams, and I think we can help each other. I would like to also thank Dr. Ellen Pereira for wonderfully moderating, and also my dear friend Dr. Manushree Gupta for wonderful moderation of this session. I'm all for it. अगर हम कुछ मिल करके आगे joint program बनाते हैं, तो Dr. Neeraj, I'm all for it. I can help any way you want. Okay, so that's from my side. Thank you. Thank you.
Thank you very much, and I will definitely come back to you with some plans, and then we will discuss mutually. Thank you, sir.
Sure. Thank you.
Thank you, sir, for those words. I would now like to invite Dr. Vikram Patra, who's at the right forefront in the management of allergies in Maharashtra. He's he will speak on behalf of our chapter, that is the Applied Immunology chapter, Allergy chapter. Dr. Vikram. He must be having some connection issues. Neeraj, if you can have the closing remarks on behalf of the IIP Allergy and Applied Immunology chapter.
So thank you very much, Dr. Ellen, for the opportunity. And I must like to congratulate and thank you first, that it was actually a very difficult topic. And even to start with, I was also not having the idea that what to do and how to do. But you have managed it very beautifully, navigated it through different aspects, and then moderating the session. And the most important thing was that you tried to connect the dots, different dots, somebody who is pediatric allergist, somebody who is pediatric psychiatrist, somebody who is adult psychiatrist, and then you try to connect the dots, and you actually made the path which is actually going to help every one of us and every one of our patients also. So thank you very much for moderating such a session. And I am very thankful to Delhi Secretary Society once again for partnering with us, and to all the speakers, Dr. Parin, Dr. Sankalp, and Dr. Deepak, for accepting our invitation and giving such a lucid, interactive, beautiful talk. So on behalf of IAP Allergy and Applied Immunology chapter, I would just like to say thank you to everyone, and thank you to all the listeners that who participated tonight for this wonderful session. All the recordings will be available on the YouTube. So if somebody who missed it, then they can once again listen to it. It was a very useful, wonderful session. Thank you, everyone, and good night to everyone from my side, from the chapter. Thank you.
Thank you, everyone. Good night, everyone.
Thank you, everyone.
Thank you, sir.
And good night. Thank you.
Thank
Thank
you.
you. Good night.